Hello and welcome. Good morning to all. We have reached aphorism number 154. Without wasting any further time, we will start from 154. Okay, and let's see how far we are going to complete it today. Because one of the important topic is coming on the way is homeopathic aggravation. Okay, homeopathic aggravation needed to be clear in your mind, because I have seen many of the modern teachers have no idea or cannot differentiate between homeopathic aggravation and medicinal aggravation. Okay, these two are totally different things. Okay, so we will deal with that homeopathic aggravation. I have seen some videos of modern teachers defining doubt, clearing their doubt to their students, and confusing between medicinal aggravation and homeopathic aggravation. Okay, you will get in your practice this kind of homeopathic aggravation, but nowadays, because of use of LM potency, I am using most of the time LM potency. So this homeopathic aggravation is not seen at the beginning of the cure. That's why I have told you in the very beginning that LM potency is very safe for a beginner to start with, because LM potency you don't expect an aggravation of such kind. Next, switching between the medicines is very easy. Means you have given sulfur. Now you can give, instead of lycopodium, you instead that series sulfur, calcarea and lyco, you don't want to keep that in mind. Switching is very easy. You can switch over to any medicines, and there is very less inimical reactions are seen in LM potency. This is particularly, it may be quite controversial that there is no inimical reaction for the LM potency, but you can switch it over again and again to different medicines. Okay, and number three is you can repeat it frequently as you ask your patient to keep a medicine, a bowl of medicine ready, and stir it well and take 1 spoon every 5 minutes till the pain or till the complaint subsided. So repetition is easy. There is no such kind of aggravation, and switching over the medicines are easy. In centesimal potency, problem is that if you prescribed one well selected medicine and by chance it's got disturbed some way, you have to think a lot before you can repeat it. You have to think a lot before you can change it. So LM potency is very safe for the beginner to start with. Okay, but one of the drawback of LM potency is it is difficult to let your patient understand why you are throwing off the rest, discarding the rest of the medicine, why you are discarding that medicine. Something of magical mayhem. Okay, not medicine. Even one of the patient asked me in the beginning, there was lot of question from the patients. When you are beginner, you will get lots of question from your patient. You will get lots of testing from your patient. Patient don't believe a beginner, and they will ask many questions. Doctor sahab, ye kyun ho raha hai, aise kyun ho raha hai? So in the beginning, 5 years ago, one of the patient asked me that Doctor sahab, isko kisi bacche se phikwana hai. Number one, means it is something magical sort of thing that a child should throw on the wall. Next, one patient asked that means kahan par फेंकना, नाली में तो नहीं फेंकना है, कहाँ फेंकना? हम बोले इससे बर्तन धो लीजिए. Okay, so that kind of thing will happen with the LM potency. So that is the side topic of discussion. We are reaching the topic of homeopathic aggravation. We have told that this is when this was first discovered by Hahnemann. We will discuss it again. Now come to the 154 aphorism number 154. If the antitype constructed, what is antitype? The mirror image. Always keep in mind the mirror image. Okay, not this. This is not antitype. This mirror image. Okay, if the antitype constructed from the list of the symptoms of most suitable medicine contain those peculiar, uncommon, singular, distinguishing, okay, in bracket, characteristic symptoms. This characteristics is not coming alone for distinguishing, okay. This is coming for all set of words: peculiar, uncommon, singular, and distinguishing. Clear? The characteristic symptoms which are to be met within the disease, containing those symptoms which are to be met in the disease. You have an artificial morbific agent which is going to produce same type of artificial disease in a healthy person. You have selected that if the antitype constructed. Clear? Now, in the disease to be cured in the greatest number, marked this number, okay, greatest number, and in the greatest similarity. Number, if the patient is having 5 symptoms, 5 characteristic symptoms or 3 characteristic symptoms, okay, the disease has those 3 characteristic symptoms, okay. This, so there is a confusion between what is the portrait of disease, what is the totality of symptom. No need to practically confused between those, okay. Characteristics, totality may constitute all of the practical, not academic purpose, not for the Viva table. I'm not telling that this totality and portrait of disease are same for the Viva table, okay. Be cautious when you are narrating your answer for portrait of disease and when you are narrating your answer for totality of disease. But for the or practical purpose, what you need is the totality, what you need is the number of symptoms, but you will give more important to those characteristics. It is well, 3 marked characteristic symptoms are there and 2 symptoms are not well marked, okay. It is well if a medicine is covering those 3 symptoms, okay, characteristics, but cannot able to cover those less marked symptom, okay. It is advisable to give your medicine if the medicine is covering those 3 well marked characteristic symptoms but cannot cover those less remarkable symptoms. Getting it? What I've told, that number is important. You are going to, like those who are using repertorization, the Bombay school repertorization for their prescription, okay, they are taking the sets of symptoms, number of symptoms, feeding it to repertory and fetching the remedy, okay. So they are going to give importance to numbers of symptoms. But in Calcutta school, what we are going to give importance to the characteristics of symptoms, the characteristic symptoms, okay, not the number, okay. It is well and good if you can match the characteristics and match the number as well, but if you can't, you are going to focus on the characteristic symptoms. Clear? Until and unless those are less remarkable symptoms are contraindicating the medicine. Clear? What I've told, that number and characteristics both are important. How characteristics these symptoms are and how many symptoms this medicine is going to cover, both are important, but what we are going to give importance is to those characteristic symptoms. Everywhere Hahnemann is telling that you are going to give importance to these symptoms which are peculiar, uncommon, striking, and singular, distinguishing, okay. You are going to give importance, but the number, mark that, greatest number and in the greatest similarity, okay. Number of the symptoms covered by the medicine is important, but it is not that important as the characteristics. If you are getting the 3, this is the rule we have formed in our last class. If you are getting the 3 characteristics, go for the remedy. This is a keynote. All these are for the practical purpose. Our classes are for practical purpose, not for the Viva table. Give the answer of the textbook, give the answer of the notebook to your Viva examiner, but for the practical purpose, it is very sure and shortest way to get to the totality, okay. I hope I'm clear in this topic. If any confusion you are having, you can ask me personally in WhatsApp group, and you can ask. People are going and coming. So at present there is no one here in the class. If you are having any confusion with this, you can ask me personally in the WhatsApp group. You can uh, anytime you can ask. Okay, I'm available. This medicine is a most appropriate homeopathic specific remedy for this morbid state. Okay, the disease, if it be not one of very long standing, underline this, if it is not of long standing, what this long standing is? Chronic one. How far the disease has been progressed, how far the disease have been, the patient have been suffering, for how long the patient have been suffering. Okay, if the disease is not of long standing, will generally be removed and extinguished by the first dose. Okay, without any considerable disturbance. Underline this line, because from this onward, without any considerable disturbance, what does mean? There is nothing sort of aggravation in the patient, no medicinal aggravation, no homeopathic aggravation, nothing, without any considerable disturbance. Okay, generally be removed. If it is of not long standing, it will be generally removed and extinguished by the first dose of it. Okay, this is not happening nowadays. This is very much rare nowadays. By the first dose you have given the medicine and it has been extinguished. It is not happening nowadays because why? Disease have been made complex. The human beings have been made complex. In the introduction, remember the first class of the introduction? Go to the introduction. At Hahnemann's time, Hahnemann is saying the disease is complex. So think that how much disease is complex now. The first paragraph. The first paragraph. Okay. Second sentence. Second sentence. In a rude state of nature, but few medicinal remedial agents were required as a simple mode of living admitted of but few diseases. Okay, with the civilization of mankind in the state, on contrary, the occasion of disease and necessity of medicinal aid increased in equal proportion. Okay, now think after 200 years how far the disease have been complicated. We have discussed, go to the first lecture of introduction, and we have discussed there how far the disease have been complex. Number one, whenever whenever anyone get pregnant, they will get lots of medication. Okay, in past there were lots of diseases directly related to the medicine patient have consumed in their pregnancy. Okay, teratogenic effects were there. So this in during pregnancy, taking medicine, having a stamp on the newborn. Okay, so the food after come after that, the child is born and have been stamped with BCG, stamped with other vaccines. Hepatitis, now hepatitis have been introduced. So stamped with hepatitis, stamped with BCG. So these are giving a good immunity to the newborn. Okay, that is the effectiveness of BCG to be discussed. Effectiveness of hepatitis is cannot means it is effective, but BCG, how far it is effective, we don't know. But it is a routine practice that they are giving BCG, they are giving hepatitis, they are giving polio vaccine. Okay, all these are stamped with these vaccines and their bad effect. Now child is growing and taking foods and supplement, how far these chemicals are going to affect his natural strength. Again, there are lots of medication, people are taking lots of medicine. So all these things, there are lots of radiations, electromagnetic radiations from these bigger phones we are having. Okay, from many chemicals in the environment, many kind of radiations in the environment. All these are making human being, making organism difficult, making organism complex. Okay, so this one, without any considerable disturbance from the first dose, is very rare. Okay, is very rare, but sometime in acute you will see the beauty of it in acute explosion. Acute explosions, you will find now and then some organism is in their purity. Basically in the villages, when the child is born in the home, not in the hospital, the child has not been vaccinated, the child is growing up in total of environment, natural environment, those patients, that's why in villages you will see pure type of sora, not in cities, but it is more common now nowadays. Those villages which are near to Calcutta are taking those patients are taking more medicine than the people of Calcutta, because with the literacy they are becoming conscious. Population of people of Calcutta are taking less medicine, rather in the villages people are taking more medicine. This is my observation nowadays. Now, so what we have told, this is rare with the first dose. Now go to 155. Now this is a connecting to the 154. I say without any considerable disturbance. I say without any considerable disturbance means, for in the employment of this most appropriate homeopathic remedy, it is only the symptoms of medicine that correspond to the symptoms of disease that are called into play. Underline this. Why? We have told that Nux vomica has 1300 symptoms. All 1300 symptoms are not going to come into play. Why? Because of smallness of dose. It is going to affect the most susceptible part of organism. In that, it is going to take out is this its symptom in that sphere only. Okay. Only the symptoms, underline from here, only the symptoms of medicine that corresponds to the symptoms of disease that are called into play, the former occupying the place of latter in the organism. Former means this one, symptoms of the medicine is going to replace the occupying the place of the latter in the organism, original disease. That is in the sensations of the life principle. That is in the sixth edition. Leave it. And thereby annihilating them by overpowering them. Clear? Why there is no considerable disturbance? Because there is no medicinal aggravation due to minuteness of dose. This is medicinal aggravation. If all the 1300 symptoms of Nux vomica came into play, what will happen? It will extinguish that disease. It will extinguish that disease by the virtue of similarity of those symptoms, but it will produce all the 1300 symptoms. Okay. So, and thereby annihilating them by overpowering them, but other symptoms of homeopathic medicines, which are often numerous, being in no way applicable to the case of disease in questions, are not called into play at all. Okay. Why? Because of, you can add in the margin, because of minuteness of dose. It is going to act only to the sensitive part of that organism, to the susceptible part of the organism, to the susceptible part which is producing the symptoms. That is only to that symptom medicine is going to give its symptoms. Okay, the patient growing early better feels almost nothing of them all, because the excessively minute dose requisite for homeopathic use is much too weak to produce the other symptoms that are not homeopathic to the case. Underline up to this. Underline up to this. This may be a question on a viva table. They will ask that why there is no medicinal aggravation. So this line you should tell, and the examiner will be happy. Okay. In those parts of the body that are free from disease and consequently can allow only homeopathic symptoms to act on the parts of the organism that are already most irritated. Underline this. Organism, part of the organism that is most irritated and excited by the similar symptoms of the disease. Okay. Thus, in bracket, sixth edition. In order that sick life principle may react only to the similar but stronger medicinal disease, whereby the original malady is extinguished in the sixth edition. This is in bracket, same thing. Thus, changing the morbid affection of the vital force into the similar but stronger medicinal disease, whereby the original malady is extinguished. Okay. So this paragraph is, I think, 2 sentences only. Okay. Just underline those what we have underlined and you will get the gist of this aphorism. 2 sentences only. This much long aphorism, only 2 sentences. One is smaller and other is longer sentence. Okay. I think 2 or 3 sentences. Now 156. Now chain is coming. We are coming to homeopathic aggravation. Now 156. There is, however, almost no homeopathic medicine, but it was so suitably chosen that especially if it should be given in insufficiently minute dose, will not produce in very irritable and sensitive part at least one trifling unused while its actions last. Okay, what does this mean? I have told that it is not produced, but there is, however, almost no homeopathic medicine. Now again, contradiction to that, there will be produced if it is being produced. If now one part was there, that minuteness of dose and not producing. Okay, but some symptoms may come, some symptoms may produce, and what will happen to that? Okay, for it is next to impossible that medicine and disease should cover one another symptomatically as exactly as two triangles with equal side and equal angle. Okay, geometry, you know that equilateral triangle means what we call from the geometry, conjugate triangle, or what, that angle and sides are equal. It is impossible for medicines, but this in ordinary circumstances unimportant difference will easily done away with by potential of the living organism and is not perceptible by the patient, not excessively delicate. Underline this. If it produce 1 or 2 trifling symptoms here and there, if it is able to produce, that will not be perceptible by the patient, will be done away by the vital energy. And this underline, not perceptible. Number 1 was why the patient is not having medicinal aggravation, because of the minuteness of dose, it is unable to produce all the symptoms dissimilar to the disease. Now if it is producing any single symptom, it will be done away by the vital force or will not be perceptible by the patient at all. Underline this, who are not excessively delicate. If the patient is idiosyncratic, you will get. Okay, not perceptible by the patient, who are not excessively delicate. Underline this. The restoration goes forward notwithstanding to the goal of perfect recovery. Underline this. Restoration goes forward to the goal of perfect recovery. If it be not prevented by the action of heterogeneous medicinal influence upon the patient, by the errors of regime, or by the excitement of passion. Underline this line. 3 points Hahnemann have clarified that action of heterogeneous medicinal substance, not prevented. Okay, you have given a medicine, patient was at ease. What is number 6 observation of Kent? I think it's number 6, no? That too short relief of the symptoms. Okay, that is the observation, one of the observation. Too short relief of the patient symptoms. What will be your diagnosis? Means too short relief of the symptom. No one is here again, so how can I interact, try to attend the live classes so that I can evaluate your learning process, how far you are getting benefit from these classes. Okay, so what I was asking, that too short relief of the patient came and told you that, doctor, I was ameliorated, I was this was my condition. I was ameliorated for this period. Now again the symptoms are coming. Again the symptoms are coming. So what will be your conclusion? Too short of relief of the symptom is one of the conclusion for this, which we learn for our examination, is that uh, there is the disease is incurable. We learn from the disease is incurable. Okay. Now, but other conclusion may be that the patient have disturbed it with other medicinal substances, okay, or error of regime. After night watching, it is having again those complaint back, or excitement. Some accidents have happened with the patient. Some incident have happened in the life of patient. Okay. So other conclusion for that, too short relief of the symptom is the patient is having error in the diet and regime. Patient is, okay, what is that? Grief, anger, and again those complaints are relapsing. Okay. And some heterogeneous medicinal substance have stopped our medicine to act. Okay, our medicines are too delicate to act with some type of, that doesn't mean you will ask your patient to stop the medicine for convulsions. Patient is taking medicine for convulsions, okay, and you ask your patient all of a sudden to stop the medicine, and patient is having severe aggravation of the symptom, and you told that, oh, this is homeopathic aggravation. No, that is not homeopathic aggravation. That is the withdrawal symptoms of that anticonvulsive medicines patient was taking. You have stopped the medicine. Even the PAND, if you have stopped, that will give rise to a severe aggravation of that gastric complaints. Okay, patient was taking that medicine for 10 years. How can you stop in 10 minutes? You have to withdraw it with a proper uh, withdrawal uh, regime. Okay, ask your patient to take half, then skip one, like that. Okay, so never stop the medicines all of a sudden. For a thyroid, patient is taking medicines for long and you have stopped that medicine. No, that is not. You have to practice. You cannot practice homeopathic medicine ideally nowadays. You have to practice those in those circumstances which is available to you. You cannot curse that, how can I give my medicine with these? You have to allow your patient, if the patient has been taking the antihypertensive medicine, you have to allow your patient to take those medicines. Don't stop all of a sudden. If the patient is taking psychotropic drugs, you cannot stop those all of a sudden. Even I told you that even the PAND cannot be stopped all of a sudden. Patient will leave you. Patient won't. It won't harm the patient. Stopping PAND all of a sudden, it won't harm, but patient will leave due to that severe relapse of the symptoms. Ask your patient to take those medicines along with your medicines. Okay, but if you are stopping anticonvulsive medicine, it will harm your patient. In certain cases, the patient will die of the epilepsy form, that continued epilepsy. Okay, if you have stopped the thyroid medicine all of a sudden and patient believe you, there is a myth in the public that homeopathic medicine, allopathic medicine cannot be taken together. These are two enemies of the medicine. No, make allopaths your friend. Okay, they are not enemies. They are just a school friend from other school. Okay, so try to take help from them as well. You can take. So you are not going to from this line heterogeneous medicinal influences. You are not going to stop these heterogeneous medicinal influences, but you should think that the patient is needing a repetition. Okay. Now, one formula I am telling you, that those patients who are taking allopathic medicine, lots of allopathic medicines for long. Okay. We are told how to antidote them. In the synthesis repertory, there are a rubric. There is rubric with particular drug, bad effect of this drug, bad effect of this type of drug, bad effect of this type of drug. Okay, if you are getting those particular bad effects, you can prescribe that medicine. There is a tautopathy. Have taken one of the case I have learned from one of my teacher, that a patient have taken a gachera medicine, gachera kuchila. Okay, that it's a common practice in Bengal, that people used to take Kobiraji medicines. Okay, and at some point of time, patient have taken kuchila, that is nux vomica seeds at some point of time, and now he is having periumbilical abscess. Okay, and it is not healing anyway. On learning upon this, he was prescribed nux vomica in high potency, and that was cured. If you are getting the direct antidote for the antidotes for the crude substance is simply the highest potency of that 1 m, 10 m, or you can go to 50 m, and that will cure. To the anti, if you are knowing that this substance at some point of time have harmed your patient, you can give it in potentized form. Some sort of like insulin is available in the market, penicillin is available in the market in potentized form. Okay, some of the steroids are, that is called tautopathy. You can use this. Okay, next you can use for Ayurvedic medicines, you can use camphor to antidote them. Okay, for metals, it is common practice to give Hepasulf, but I have not seen any particular effect for that poisoning of metal. It's better to give that metal if the patient is having poisoning of that. It's better to give that metal in potentized form. Iron. I have discussed a case of Dr. Yunan, which Dr. Yunan was a Greek Armenian practicing in Kolkata, and he was in Calcutta for rest of his life, and he was teacher of Dr. Gyan Majumdar. So Dr. Yunan, one of the you will learn. I have learned this case from Hughes pharmacodynamics in chapter, I think, Ferrum Met. He mentioned that Dr. Yunan of Calcutta have reported this case, and later on I found that this Dr. Yunan was the teacher of Dr. Gyan Majumdar, and he was practicing nearby from my clinic. He was practicing around my clinic, that Tiratti Bazaar and Isra Street, all this. So he went to see a patient, and he told that my parrot is sick. See, my parrot is not eating, just getting weight loss. Parrot, okay. टिया पाखी बांग्ला में बोलते हैं, तोता. तो he is not getting weight, and he is not gaining weight, losing weight rather. So he saw this iron ball was there for water consuming, and parrot was taking water from that iron ball. So he asked to remove that ball and replace with stainless steel, and give the parrot ferrum met in high potency, and parrot was well. So this is a documented case in pharmacodynamics of Hughes mentioned of. So we have drifted apart to a story. So we were telling that you have to practice in available circumstances. You cannot create an ideal circumstances for your practice. Okay. Now, excitement of errors of diet and regime you can control. Okay, one of my patient is coming to me for uric acid. His uric acid used to be 10, 11 like that, and having severe acute attack of gout. Whenever he is taking this fish, especially that special fish recipe, I am forgetting that. Whenever he is taking that, he is going to have a severe effect of gout, severe attack of gout. So this you can control, your patient can control. Diet and regime, error of diet and regime. Going to sleep late, that is aggravating his constipation. Going to sleep late, that is aggravating his gastritis. Okay, so this you can control, your patient can control. But excitement of the passion you cannot control. You have to give your medicine. either you have to repeat your medicine because of that passion have been antidoted, that passion have antidoted your medicines, or you have to give the antidote to that passion. What kind of passion was that? Fit of anger was there, grief was there, insult was there, what kind of emotions was there? Okay, you have to antidote accordingly. Okay, and then continue with your medicine. So underline these are actually you will find in Robert's deflected current. One of the case I have must have shared with you, that a lady was getting cure of his cough again and again, relapsing. So finally we found out that the lady was nowadays using the mosquito coil in the room. She's sleeping. We asked to remove that mosquito coil and the cough was totally cured. Okay, so these kind of cases you will get in your daily practice. So you go and read Roberts deflected current. Deflected current by Roberts. Now go to introduction. 157 content. Go to content. Aphorism number 157 to 160. 157, what is written there? The medicinal disease, very similar but somewhat superior in strength to the original disease, termed also homeopathic aggravation. Okay, underline this, and this is a group of aphorism 157 to 160. This is dealing with homeopathic aggravation. Okay, this was, we have discussed, this was a stumble block for the Hahnemann to move further. This was the stumbling block for Hahnemann to move further. In 1794. Now 1797. Okay, 1797. Hahnemann got this, first noticed this homeopathic aggravation in 1797, when we were discussing in the very few classes regarding the importance of Hahnemann's timeline and development of homeopathy. We have discussed this part, that Hahnemann was getting aggravation with his medicines, that previous authors also got aggravations with their homeopathic medicine. What Hahnemann have mentioned in introduction chapter, that they were termed as dangerous. Okay, even now you will get the warning on the chloroquine patch that this may cause symptoms of may exaggerate the fever if taken in excess. Okay, so let me find out in introduction. In introduction, that was termed, actually what I'm saying, that previous author also have find these, but they these homeopathic remedy, but they termed it dangerous because of this homeopathic aggravation. What does this mean? This means that previous authors also have found homeopathic aggravation. Okay, leave it, it is somewhere in the introduction and footnote. We have discussed it. Go to the that lecture and you will get. So at that time, this was also Hahnemann was getting, okay, cure in some cases, and in some cases he was getting this homeopathic this kind of severe aggravation of the original symptoms. Okay, so this led Hahnemann not to stop, but rather to investigate how to overcome this. Okay, how to overcome this, and he overcome this by introducing minute doses. Okay, gradually and slowly from the crude drug substance, Hahnemann have moved to LM potency. From 1897, we have shown it with a graph that how from 1897 to he reached to the LM potency. This is the evolution of homeopathy. Okay, and the timeline of Hahnemann we have discussed in some I think it was lecture number 3 or 2. We have discussed importance of timeline and of Hahnemann and development of homeopathy. So how he reached to the minuteness, how he reached to the potentization from this continuous zeal of Hahnemann was that to perfect his system of medicine. And this was a stumble block for Hahnemann, that the patient was aggravated. The original disease were being aggravated by his medicines. In 1797, colicodynia, case of colicodynia, and was aggravated with the veratramaldon because patient have taken double of the prescribed dose and was severely aggravated, and then that symptoms never returned again. Okay, so he discovered this homeopathic aggravation. Okay, and from that only there is a common myth in the people that homeopathy पहले बढ़ाता है फिर कमाता है. ऐसा नहीं है. If you are having a proper minute dose, the homeopathic aggravation will not be that severe. Okay, except in some cases. So from 157 to 160 is homeopathic aggravation. Let's read it. But though it is certain that homeopathic selected remedy does, by the reason of appropriateness and minuteness of dose, generally remove and annihilate the acute disease analogous to it, without manifesting its other unhomeopathic symptoms. Underline this. Homeopathic selected medicine in acute disease. Next, without manifesting its other unhomeopathic symptoms. That is to say, without the protection of new serious disturbance. Yet it usually immediately after ingestion for the first 4 or a few hours, cause of slight aggravation. Underline this, usually immediately after ingestion. In acute diseases, he is telling. In acute diseases, when the homeopathic aggravation will occur, first hour or few hour, cause of slight aggravation. Okay, for the sixth edition का मामला पूरा different है. Leave it. Where now sixth edition छोड़ दीजिए. From next, where the dose has been somewhat too large, however, for a considerable number of hours, which has no resemblance to the original, which has so much resemblance to the original disease that it seemed to the patient to be an aggravation of his own disease. Underline this. So much resemblance to original disease, it seemed to the patient that it is his original disease, aggravation of his own disease. But in reality is nothing but an extremely similar medicinal disease. Underline this. Okay, underline this. Next, in chronic cases, in acute cases first few hours, in chronic cases it will first few days, rather 7 to 8 days. Aggravation, you expect an aggravation in 7 to 8 days. In chronic, as a rule, in chronic cases you expect an aggravation somewhat at later period, but in acute cases first hour, few hours, when the dose is not very large, it will produce some symptoms for considerable number of hours, for long period. Too long homeopathic aggravation, first first observation, too long homeopathic aggravation, and the final decline of the patient. Final decline you won't see in your practice. Maybe you will someday you will be able to see some 1 or 2 cases final decline, because we are so much afraid of getting that first reaction. So we expect to in those serious cases we are starting with a low potency. Now underline so much resemblance to the original disease, in bracket you can write in chronic cases 7 to 8 days. Okay, in chronic cases this aggravation in margins you can write for 7 to 8 days in chronic cases. In acute cases first hour or a few hours. Next, 158. I hope you have underlined resemblance to original disease, aggravation of his own disease, and extremely similar medicinal disease. Okay, now 158. Homeopathic aggravation is a good sign in first hour. It is not that you have asked your patient to stop anticonvulsive medicines and the patient have been aggravated and you are thinking that this is homeopathic aggravation. No, this is not homeopathic aggravation. Rather, it is the withdrawal effect of that anticonvulsive medicine patient were taking. No, 158 now. This slight homeopathic aggravation during the first hour. Okay, the line bracket is there. A very good prognostic that acute disease will most probably yield to the first dose. Okay, very good prognostic. That is why we are telling that observation number 4 is not a perfect observation, means not a desired observation. Aphorism observation number 4 of Kent: no aggravation and amelioration of the case, because physician is not sure. Perfect observation is, desired observation is 3: a quick aggravation and permanent amelioration. This is observation number 3 is desired, not that 4 without any aggravation. So that is why from here it is taken a very good prognostic that acute disease will almost probably yield to the first dose. So slight homeopathic aggravation during first few hours is quite as it ought to be, as medicinal disease must naturally be somewhat stronger than the malady to be cured if it is overpowered and extinguished the later. Just as natural disease can remove and annihilate another one similar to it only when it is stronger than the later. Aphorism number 43 to 48. So homeopathic aggravation is a good sign during the first hours. Now, smallest, now 159. The smaller dose of the homeopathic remedy, so much the slighter and shorter is the smaller the dose of homeopathic remedy, so much slighter and shorter is the apparent increase of the disease during the first hour. Apparent increase, underline this. Apparent increased. Slighter and shorter. What does this mean? Smaller the dose in terms of, you can say in terms of potency, and smaller the dose, okay, shorter the, slighter and shorter the homeopathic aggravation. Apparent increase, that is homeopathic aggravation. Okay, smaller the dose, lesser the aggravation. Sometimes repetition also cause very much aggravation. Okay, conjointly. Repetition of the improper repetition of the medicine will cause also aggravation, and sometimes it is medicinal aggravation, not the homeopathic aggravation. Repeating after medicine Thuja 30 in you have given your medicine Brina 30 or Rastrox 200 in successive doses, that will produce the symptoms, that will induce patient to produce some unhomeopathic symptoms also, and those unhomeopathic symptoms to the case is nothing but the medicinal aggravation. Okay, but as the dose of remedy can scarcely ever be made 160, but the dose of homeopathic remedy can scarcely ever be made so small that it shall not be able to relieve, overpower, indeed completely cure and annihilate the uncomplicated natural disease of long standing that is analogous to it. We can understand why a dose and an appropriate homeopathic medicine, not very small as possible, does always during the first hour after its ingestion produce a perceptible homeopathic aggravation of this kind. What does this aphorism means? You cannot make a dose of homeopathic medicine so small that it won't produce the homeopathic aggravation. If it is not, if it is made that small to that of the patient's disease, it won't affect. Patient was needy. Suppose, try to understand this. Patient was needing, 1 minute. Patient was at this plane. Okay, patient was at this plane, and you are giving a medicine at this plane. Okay, patient needs medicine at this plane, and you are giving your medicine at this plane. It won't affect your patient. Okay, you have to give your medicine at this plane. You have to raise your potency. Okay, at this plane. Okay, that was I was telling, I forgot to tell you, means in between that I was telling, no, that patient have, after taking lots of homeopathic medicine, have came to you, and uh, you give your medicine in highest potency, 1m 10m. It won't affect the patient, because the susceptibility of the patient have gone down. In those cases where a patient is taking allopathic medicine for long, you have to choose a low potency. Okay, you have to choose a low potency. Plane of the patient is important for choosing of your patient. If you are giving 10m, it is going beyond, it won't affect. Patient is at this plane. Okay, and you are giving your medicine at here, it won't affect your patient. Okay, if your patient is at this plane, and if you are giving medicine this, it won't affect. You have to choose your medicine rightly. This is your plane to play, 30 to 200. Okay, suppose this is 30 to 200, this is 6, and this is 1m 10m all. Okay, most of the patient falls under this 30 to 200, but those patients who are consuming allopathic medicines for long falls under this plane, 6 and below. Got what I have tried to told you? I hope you got it. Patient, for convenience we are dividing. This is our patient. Okay, this is the plane of our patient. This is your playing ground, 30 to 200. Mostly the patient, by your potency, by giving your medicine, patients rises. Why we are ascending in potency? Because patient will rise in. That is a concept of Vitolka's levels of health. There are 12 levels of health according to Vitolka. Increased level of health. Okay, so patient is rising from this level to upper level, and you are going to prescribe 1m 10m. Okay, but if your patient is here and you are prescribing, your patient is here and you are prescribing 1m, it won't affect your patient. Okay, if your patient is here and you are prescribing 6, that won't affect. If your patient was here and you are prescribing 32, that won't affect. You need this range, 6 to q or q to 6. Okay, q actually is not we are not prescribing q, we are diluting q in the half cup of water and giving. To some extent its power increased to 1x or 3x, like that. Okay, direct q is not prescribed. So q to 6, this plane, 30 to 200, this plane, and 1m to higher, this plane. So this is thankfully most of the patient falls in this range, 30 to 200. You cannot make your homeopathic medicine so small that is not this is quite contradictory to 160, aphorism number 160. What is telling? You cannot make your medicine so small that it won't affect your patient, but this we have seen in practice that this is possible. This is possible that you have given 6 potency, you have given this potency and is not acting on your patient. You have given 1 m 10 mcm and it is not acting on your patient because it is rebounding, going back, because the patient is at this plane. This is quite seems quite controversial, but it is very useful in practice. Okay, so what I have done, I have categorized the susceptibility of my patient depending upon what? Depending upon the pathology of disease, depending upon the allopathic medicines he is taking for long, depending upon the diseases he have suffering from his childhood. If he is suffering from some kind of violent diseases, acute diseases from his childhood, that means he is having higher susceptibility. These things to be discussed when we are discussing the choice of potency and doses. Okay, this should be discussed. If you are getting patients suffering from just allergic rhinitis from his childhood up to the patient is coming to see you, At that period, nothing else, just running nose, doctor kuch nahi hota, bas yahi hota hai, and I'm taking anti-allergies. That means the susceptibility of patient is so low that you have to at 6. You cannot give him one potency. It won't affect your patient anyhow. Okay, because the susceptibility is so low. I have told that in Stuart Claus chapter of doses, you will get a case of Stuart Claus that was not getting cured with digitalis. All potencies were tried and was not cured, and allopath came and gave digitalis in crude, and the patient was cured because the susceptibility the patient was operating was of this. Okay, so what we have done, we have divided our patient for the convenience of our practice. We are trying to divide a patient at 3 levels: 30 to 200, Q to 6, and 1 to higher. Thankfully, most of the patients are falling under this. Okay, most of the patients are falling under this plane. This is our playing ground, thankfully. But some patient may fall to this. Some patient may fall to this. You have to be very sure. And how it is decided? 2 things I have told you. The allopathic medicines patient is taking for how long? Number 2, the kind of disease the patient is suffering from since his or her childhood up to he is seeing you. Okay, the kind of vaccines he has taken. If the patient have taken anti-tetanus serum for long, okay, every 1 month, every 6 months he is taking ATS. This is going to decrease the susceptibility of the patient and decrease the level of their potency operating frequency. Okay, and if the patient is have suffered from high fevers, is able to respond to high fevers. अभी हुआ था डॉक्टर साहब, अभी हमको 1 हफ्ते पहले 104 फीवर हो जाता था. ओके, अभी हमको 1 महीने पहले 103 फीवर हुआ था. दैट मीन्स द पेशेंट इज एट हायर लेवल. ओके, दैट मे बी हियर और मे बी हियर. Okay, doctor, हम हमेशा चिकन पॉक्स, आई एम सफरिंग फ्रॉम चिकन पॉक्स, मीजल्स, दिस एंड दैट मीन्स susceptibility is high. Suffering from acute diseases. Those patients who are not suffering from acute diseases are rather suffering from dangerous and grave type of chronic diseases, which is making their operating frequency for the potency lower and lower. Those patients who are having some pathology, grave pathology, that operating frequency will be Q to 6, lower potencies. Clear? I hope. So this is quite contradictory what Hahnemann have said in aphorism number 160. You cannot make homeopathic remedies small. Rather, we have seen we can make homeopathic aggravation, homeopathic remedies sometimes smaller and sometime higher to the plane of the patient. Okay, this is quite a conceptualization to ease the selection of potency. I hope I make it clear. If you are having any question, you can ask me. No question of asking. You can go through lectures and contact me in a group or personally in the WhatsApp. Thank you. We will meet again next Sunday.